Good morning, everybody. Pleasingly, New South Wales has already completed 86.7% of first doses in our 16 and over population, and we're inching closer to that 90% first dose and looking forward to that important day. In terms of second doses, we're up to 62.9%. So we'll definitely hit that target by Monday, the 11th of October, of opening that day. So I ask everybody to remember what you can do at 70% and make sure we stick to the rules then. In terms of 12 to 15-year-olds, we have 47.6% who've received their first dose, given that's only been available for a couple of weeks. Can I thank all the parents and students and young people who've come forward to get vaccinated? These vaccine rates are continuing at good pace, and pleasingly yesterday, as Dr Chant announced, anybody in New South Wales over the age of 12 is now able to receive a Pfizer or a Moderna vaccine from their GP or a pharmacist or from a New South Wales health hub. And we really want to make sure that if you're someone who hasn't had any vaccine, please come forward and get vaccinated. Don't wait. It's better for you, your loved ones, and also for the greater community. And I urge everybody who hasn't had that vaccine to come forward and get vaccinated. Pleasingly, I can announce today that schools will resume 1 week earlier than we'd anticipated. When we set the date for schools opening on the 25th of October, we did it for two reasons. Firstly, to provide certainty for parents and school communities, and secondly, to make sure we'd already surpassed that 70% double dose figure. We didn't realise at that stage how quickly New South Wales residents would take up the opportunity to get vaccinated. So this is a safe way of resuming schools, but the staggered approach will remain in place. So the education team have been dealing with the health team for some time now, and whilst we can bring that week forward, the start date forward by a week, which I know is welcome relief to students, teachers and families, the staggered system, the staggered recommencement will still be in place. The schools feel better in having that staggered resumption, but at least all students, irrespective of what year they're in, can look forward to returning to face-to-face learning a week ahead of schedule. And obviously, the New South Wales government, on the basis of health advice, will also be giving good advice to schools on what happens if there is a case. We want to avoid disruption as much as possible, but when all the teachers are vaccinated, a large proportion of 12 to 15-year-olds are vaccinated, that will change the way in which we deal with cases potentially at school, and there'll be further advice provided in relation to that matter. I also want to foreshadow, whilst we won't be announcing anything today, that the government is considering bringing some things forward from the 1st of December to 80% double dose. There won't be major things, but there will be tweaks. And we'll announce that once we get to 70% double dose. But I do want to foreshadow, I know there are a number of people in the community who've asked for us to consider certain things, and health is considering those things. And if it's safe to do so, we'll be able to resume some of those activities at 80% as opposed to first dose, as opposed to 1st of December, I should say. And finally, I'm really pleased to have the New South Wales Treasurer here with us. The New South Wales Government takes enormous pride in supporting our business community during what has been a very difficult time. And whilst there are certain sources of funding which the Commonwealth understandably is not providing beyond a certain point, the Treasurer has done a lot of work as to how we can continue to support small businesses during this difficult time, especially between 70 and 80%. And I just want to emphasise again what we've been saying week on week. We're all looking forward to that 70% double dose Monday the 11th of October, but between 70% and 80% double dose, which we anticipate will only be 2 or 3 weeks, we ask everybody to be extra safe, extra cautious. Yes, it's fantastic we'll be able to do so many more things we hadn't been able to do before, but at the same time, we need to be cautious until we get to that 80% double dose vaccination. So now Dr Chant will provide the health update. The Treasurer will give some good news to businesses across New South Wales, and then we'll take your questions. Thank you.
Thank you, Premier. So New South Wales recorded 941 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 1 overseas acquired case. And there were 120,993 COVID tests were reported to 8 p.m. last night. There are currently 1,090 cases admitted to hospital, and we have 213 in ICU, spanning all of those age ranges. In terms of the suburbs of concern, so whilst we've been indicating that we're pleased with the decline in cases in some of our suburbs in southwestern Sydney and Western Sydney, now is not the time for complacency. We are seeing some concerns around Marylands, Bankstown, Lamia, Revesby, Fairfield, Woodbury, Mount Druitt, Liverpool, Unanderra and Yaguna. It is important that everyone presents for testing and that everyone takes this opportunity to get vaccinated. We're particularly calling upon young people in that age group of 16 to 39. It is critical. You haven't had the opportunity to be vaccinated for a while. Please take those opportunities now. It will protect you. It will protect your loved ones. But also because you are the connector across generations, you do contribute more to transmission. So please get vaccinated. Sadly, we've had to announce the death of 6 people with COVID, 4 men and 2 women. 3 people were in their 70s, 2 were in their 80s, and 1 person is in their 90s. And can I pass on my condolences to their loved ones? 2 were from southwestern Sydney, 1 person was from Sydney's inner west, and 1 person was from western Sydney, and 1 person was from southeastern Sydney, and 1 person was from northwestern Sydney. 4 people were not vaccinated, and 2 people had received 1 dose of a COVID vaccine. In terms of sewage detections, we've got sewage detections in Gunnedah, Tweed, Benora Point and South Grafton in northern New South Wales, Goolong in western New South Wales, Dareton in far west and Maruya and Thredbo in southern New South Wales. We are seeing an increase in cases in our regional areas and again urge everyone in regional areas to take the opportunity to get vaccinated as quickly as possible, but also to please keep presenting if you have any symptoms of COVID. In Illawarra, there were 82 new cases, and again in Hunter, we're seeing an increase in cases to 82 new cases. Thank you.
Thanks, Kerry. Well, it's obviously been a very difficult time, but I think we are certainly coming up to a very bright summer here in New South Wales for all our businesses and workers right across the state. We always said from the outset that success for New South Wales won't be the budget position, but keeping as many people in work and as many businesses in business during this difficult time. And that's why today the New South Wales Government is pleased to announce that whilst we are tapering down with the federal government, the support package for JobSaver from between 70 and 80% double-dose vaccination, the New South Wales Government will maintain its contribution to that program until 30 November. We know that when we do open up at 70% and 80%, that there will be still some restrictions in place, that businesses will not be operating at full capacity. So by maintaining the New South Wales Government's contribution to this program, it will allow many businesses the support they need as we move from response to recovery. And whilst it's going to be a difficult time as we go through that reopening, I'm incredibly confident that the New South Wales economy will bounce back. We provided now, through the course of today's announcement, during this Delta outbreak, around $8 billion in financial support, and that combined with the federal government around $12 billion in financial support to keep businesses in business and to keep people in work. It's going to be, I think, a very bright summer here in New South Wales as we do open up. Vaccination has been the key here in our state, and to hear those numbers today from Dr Chant, the Premier, it has really been the key to our freedom, and to be in a position now, we look back at where those numbers were, our reopening date is ahead of where we thought it would be, and that's because of the great work of every single person right across the state. And this continued financial support from the New South Wales Government during this period will ensure that businesses will have that cash flow, that as people come back into work during this period of time, as the disaster payment finishes from the federal government, that the New South Wales Government is still there to provide that support as we head into summer. Importantly, we're the only state in the country that has provided financial support for businesses with a turnover of less than $75,000, and we will provide that post 80% at a rate of 50% of where it was prior. So it will be $750 a fortnight rather than $1,500 a fortnight. But whilst this has cost the budget substantially during this period, we have always, the government, had our #1 priority to keep people safe, but providing this financial support will give businesses the sustained cash flow to help them as they open up, as to what I expect our state not just to have a strong economic rebound, but to come out stronger the other side. So today is a great announcement for businesses right across the state. It gives them the certainty of having that cash flow from the New South Wales government as we reopen into a bright summer.
$8 billion all up. How much is this 6-week extension itself going to cost?
Around five to New South Wales?
Yeah.
Around $500 million in terms of the extension. So that's included in the $8 billion expectation. Ultimately, though, Tom, we'll also expect to see many businesses fall out of the system as they open up. So the 30% turnover requirement, a reduction is still in place. We will be asking businesses on a fortnightly basis to provide information to Service New South Wales that they are still eligible, and there's two key criteria there. One is that they still qualify due to a 30% reduction in turnover, but also that they've kept on their staff. And as you know, we said from the outset that our preferred position was that the JobKeeper program was in place, and part of that was to keep that nexus between the employee and the employer. But part of the agreement with the federal government, which obviously we appreciate here in our state, and we thank them very much today for the support they've provided during this period, that employers, in order to qualify for these payments, need to keep their workers on the books. So they need to obviously confirm that every fortnight through the Service New South Wales process.
173,000 jobs lost in the past month. Are you disappointed that the Commonwealth is not extending with you?
Look, I appreciate the support they've provided for our state, but ultimately, as a state government, our number one priority is to keep our people safe. We have restrictions in place. It's been a very difficult time, and the decision that the Premier and myself and our crisis cabinet has made yesterday is to keep our support going.
But in your opinion, it's too early because you're extending, but the Commonwealth government is not.
Well, at 50% post 50% contribution, post the 80% double dose, there's no doubt that those support payments need to be taken down because businesses will be open again. Most businesses across the state will open up. Trade will begin again. That will be a great thing. But our government's position is all, and I thank the Commonwealth governments for their support during this period. I mean, it's been budgets around the country aren't looking too great now, but we have said and are completely committed. Success for me as Treasurer has been at the end of this pandemic, what is the unemployment rate and how many businesses have we kept open? That's what success is, and so it was a very easy decision for me to recommend to Crisis Cabinet yesterday that we keep our contribution going up to 30 November when we will have opened up most of the restrictions that were in place.
What about those businesses that are... What about those businesses that are reliant on international tourism? Bridgecline, for instance, it's all international tourism. Are they going to survive?
Well, obviously, and I've worked very closely with that group, as all tourism and accommodation providers have gone through a very difficult, not just 3 months, but 18 months during this period. And, we will be announcing very shortly, the Premier and I, during October, our economic recovery plan. So today is continuing our economic response, our financial support for businesses, but that will very quickly turn to our economic recovery, and that will be announced in October, and it will obviously support those industries that have had it have gone through a very tough time during this period. But I'll also say, when it comes to the tourism industry, New South Wales is on track to be the first state to open internationally. We want to lead our nation out of this pandemic, and I think the key to that has certainly been the vaccination rates. But what you will see is other states continue to shut down, that New South Wales opens up, and we're on track to do that, and that's going to be a great boom for the tourism industry, a great boom for accommodation. We know they've done it particularly tough during this period because, as you say, particularly in Sydney CBD and places like that, which are incredibly reliant on tourism, for many of those businesses to survive during our recovery phase, you will see added focus, and that continues on from last year, but an added focus on ensuring that particularly the tourism industry gets back on its feet. And I know the Minister for Tourism, Stuart Ayres, is doing a lot of work in this space, and I'm very confident that once again we'll rise to the top.
Skills Premier, obviously bringing it forward by a week. 1 or 2 weeks to bring it into line
Look, the Education Department and the health experts considered that, but we need to make sure that we obviously have fully vaccinated teachers available. We need to make sure that school communities have enough time to gear up. and also that there's enough confidence that it's safe to do so in that way, and also to give extra protection with the rates of vaccination. It's already nearly 48% of 12 to 15-year-olds that have had the vaccine. Our adult coverage is outstanding, so that extra week between the 11th and the 18th, for a number of reasons, gives school communities that extra level of protection, because we don't want unnecessary disruption to school communities. We know that there are going to be more cases once we start opening up, but we also know that with the vaccination coverage, that will prevent serious illness. And we want to reduce the disruption that schools go through when there's positive cases. And for all of those reasons, all those things were considered, and we've been thinking about this ever since we realised 11 October was the more likely date for us starting to open than the 18th. We started looking at the schools and what was the best way forward. And after a lot of consideration and analysis of various scenarios, we deemed this to be the most appropriate, based on the health advice and also based on the advice from the Education Department and the experts there. And the feedback we've received is that school communities still want that staggered start, but what it does mean is that every child, no matter what year of school they get educated in, will start a week before than they anticipated.
What do you say to those teachers who say they're not ready to go?
Well, this is the challenge for governments during this difficult time. For every person that says they're not ready, there's 2 or 3 others that are saying you're taking too long. So we know that when you make a decision like this, not everybody will agree with it, but we have to make decisions based on what is in the best interest of the majority of our students and parents and families. We know that many parents will be starting to go back to some level of work on the 11th, given New South Wales is starting to open. But also, most importantly, let us not underestimate, although children are extremely resilient, let us not underestimate the impact of being separated and isolated from their friends and from that school community has had. And the quicker we can get them back into a routine, even if it's a week in a child's life, that will make significant difference to their social wellbeing. And so we're really keen to make sure that.
But haven't they had 14 weeks? Here's just opportunity to take a swing. Haven't they had 14 weeks to get ready?
Look, it's not just about getting ready for schools to reopen, it's also about making sure we have healthy vaccination rates amongst the adult population. We know that often it's not so much the children on the school campus that's the issue. As Dr Chan and other health experts have often said, it's parents dropping children off at the same time and mingling with each other unintentionally. There's a whole range of factors we need to consider, how children get to and from school. So all of that was considered in the decision making, and this was found to be the safest and most appropriate decision.
Do you know what percentage of teachers are vaccinated now? If vaccination is kind of the key thing that's holding you up from bringing it further forward?
We know it's extremely high, and by the time schools go back on the 18th, there will be enough fully vaccinated teachers to make sure the school system proceeds, and also that there's enough time for parents to plan as well. We know this is a great time, an exciting time for students and school communities, but also parents need to plan ahead.
Do you have a percentage? What is
I don't have the exact percentage, but the last time we checked, it was way above the state average. So we're confident we will not only have enough teachers, but that the population in teachers who are vaccinated is above the state average.
All the regional schools that just had
Teachers who don't get vaccinated by that date, they'll be stood down.
No, exactly. And as far as, can I just make a comment on the health workers and say, can I thank the health workers for their rates of vaccination? In some local area health districts is as high as 98%. And that obviously includes people who might be on extended leave, who aren't working, people who have new entrants to the system. So across the state, it's 97 or 98% double dose vaccination already, which is outstanding. Can I thank all the health workers for expediting their vaccinations and making sure they come forward and get vaccinated. Really a great result, and I'm just thrilled when I saw those figures this morning. It gave me heart because it shows, I think, how committed all of us are to moving forward together, to making our system run as efficiently as possible, especially as we face the most challenging weeks ahead in our hospitals and our intensive care units. It's just reassuring to know how passionately our health workers not only put themselves on the line, but also have got themselves vaccinated to keep all of us safe.
So they'll face the same treatment.
Oh, that's my understanding.
Yeah. And if they are not fully vaccinated by they can't work. But
My understanding...
Before the 8th, until they're fully vaccinated, there won't be any unvaccinated teachers.
Correct.
So parents can be assured that...
Correct. Parents can be absolutely assured that every teacher who works with face-to-face teaching will be fully vaccinated.
Just to confirm for the regional schools that just had a lockdown extended to the 11th, does the staggered return apply to them as well, or will they go on the next available day?
The staggered return applies to all schools throughout the state, and that is to make sure we all move forward together. Look, there are always exceptions, and that might be for particular reasons, but generally speaking, that return to school will be consistent across the state.
The 2% or the 2 or 3% of unvaccinated healthcare workers today, I think, is the cut-off roughly. How many are actually going to be told you're not coming back to work today, or do you have a number?
I'll have to check that figure, but remember that 2% that aren't, 2 or 3% that aren't vaccinated includes people on extended leave. It includes people who are perhaps not working at the moment. It includes people who've just come into the system who will get their vaccination. It includes casual workers who might be entering the system. So in reality, I think the rate of vaccination is actually even higher than that. So it'll be just a handful of people that it affects.
I know that more detail is coming about whether if there's an outbreak in school that they'll need to shut down, but how likely is it that we are going to see disruption in schools where it's going to be toing and froing between in-class and homeschooling for the rest of the year?
Well, I can confirm that the health officials are finalising their advice to government, which we'll make public in the very near future, about what tracking and tracing and close contacts look like for all of society when we hit 70% double dose. So it will be different. When you have 70 or 80% of your adult population fully vaccinated, it does mean you deal with contact tracing differently. So you don't have to be as cautious with close contacts. You don't have to be as cautious with a whole range of things you deal with, and that applies to schools as well. So as soon as that advice is provided to us, we will make sure we make it public to give people at least a week's notice before things start opening, what that looks like. But I do want to make clear that contact tracing and the way we deal with positive cases for fully vaccinated people will look a bit differently to what it does today, and you understand that when you have 80% adult coverage or 70% adult coverage, and by the time we open at 70%, Dr. Chan and I are crossing our fingers that we'll have 90+% of people with at least their first dose. We're hoping to get to that 90% figure of first dose by the end of next week. So by the time we open up on the 11th, that will already be in place. And that gives us confidence on how we approach contact tracing, how we approach returning Aussies from overseas. There's a whole range of issues that will be very different, and the government looks forward to providing that advice publicly as soon as we finalise those pieces of work, which we've been working on for some weeks now.
Jan, can we just ask about...
The 20 cap decision on venues and allowing them in, why was that change made? And you did flag earlier that you'd bring other things forward from December 1. Yeah. Can you tell us the industries that you're looking at?
So what we're doing now is obviously we've publicly announced what the 70% roadmap and 80% roadmap and what 1 December looks like. But when you're then drafting the health orders, which we've publicly made available, if there are any glaring inconsistencies, if that's the time to fix it. So obviously at 80%, when you can have a wedding at 1 per 4 square metres in any venue, it didn't make sense that you wouldn't be able to have that wedding at a place outside of a function centre. So for those reasons, the cap won't exist at 20%. So I think it's important for us to note that obviously public policy is clear on what we're doing at 70 and 80 and 1st of December, but please allow us to make some tweaks, because when you actually translate that into law is when you actually see where there may be some glaring inconsistencies. So I do want to foreshadow that the health team is considering a couple of aspects which we hope to be able to, which confidently we can implement at 80% as opposed to the 1st of December. But one thing, potentially yes. So I will foreshadow that is one of those things we're looking at. But specifically in relation to lessons, not more broadly, we have to be very careful, because whilst we're all excited about opening up, the threat of surging, look, the cases are going to surge. We just need to make sure that occurs in vaccinated people and not the unvaccinated, because that hurts all of us. It hurts the unvaccinated person, it hurts their family, and it hurts their immediate community. So I will foreshadow that we are looking at things that can be done at 80 as you go make these laws applicable, but to make things simple and make sure the public comes on the journey with us. We know clearly what's happening at 70%. So in the week that we open up at 70%, we'll be able to make comment on what the 80% tweaks are. But I just want to be clear on those things. Please just be patient with us. This is something that no state in Australia has done, and we can't stuff it up. So we need to tread carefully. We need to make sure we provide that right balance of freedoms, but also safety. And I say again, all of us have to be cautious between 70 and 80%. I will sleep better at night once we get to that 80% double dose, because between 70 and 80%, the roadmap we've outlined is completely safe and cautious, but it still means that 30% of 16 and overs haven't been fully vaccinated. And that is a risk to the system, but I have faith in the people of New South Wales, as I have right from the beginning. In the last 18 months, we've demonstrated our capacity to also manage our own personal risk. And I know many of us, even in my friends group, many of my friends have been saying, we're still not going to go out every night, we're going to be careful with where we go until we feel confident. And that's how a lot of people might be feeling. So please enjoy the new freedoms, but please do them cautiously.
Segue there into that, what's going on in Melbourne at the moment, or Victoria. Have you got a comment about that incredible increase in cases overnight?
Look, just to say, it's a very, we've been there in New South Wales, it's a very scary position, and I just wish our Victorian citizens and the Premier and his team the very best. It is a difficult, dark time. Now that our vaccination rates are where they are, we can move forward with confidence. But the one positive I will say to Victoria is because their outbreak happened a bit after ours, their vaccination rates are higher when they hit the outbreak. So I say to them, be optimistic about the future. Yes, it's a difficult time now, but you'll get through this, as we did. And you have one advantage that we didn't have. We didn't have vaccination rates when our outbreak occurred. We had supply constraints on the vaccine. We had to fight to get the vaccines, and I'm so grateful we got them. And then we were able to manage that targeted strategy of getting them into those communities that needed them the most to reduce the spread. But I say to Victorians, you will get through this. We got through it, you will get through it. In fact, you have an advantage in that the outbreak, the worst parts of your outbreak are occurring when you have higher vaccination rates than we did. So I say look to the future with optimism, hang together, and I'm sure you'll get through this as we did.
Premier, what's your advice for businesses wanting to mandate vaccines in the workplace? When there's not a public health order, it seems like a very murky area. Should they be getting their own individual legal advice?
Well, the New South Wales Government is actually providing guidelines to business. As I said, in the next, I don't want to say a few days, but in the next week, the New South Wales Government will be making public information available on what tracking and tracing looks like. Once we hit 70%, we'll be providing guidelines to business. So obviously, health orders cover those professions where there's mandatory vaccines in the workplace. So hospitality venues and other places have mandatory. For those businesses that don't have mandatory policies in place, we will provide some guidelines. And it will be up to the business as well. But I don't want to say too much until those plans are finalised. So we've got all of our best brains in government assisting us in that process. I would have liked to have seen a national strategy for that, because there are lots of professions that are covered by federal work health and safety regulations, but we are doing, as we do, the hard work to get that right, and we'll be publicly making that clear so that businesses do have that clarity.
Premier, a question from my colleagues in Wollongong. They say a significant number of people in social housing in Wollongong are struggling to get access to the vaccine. COVID numbers are growing close by, they're worried. How is it that this late in the pandemic, some vulnerable people still can't get access to the vaccine?
I'll ask Dr. Chan, who's been working and updating communities down there, but can I say it is access to the vaccine is not the issue, but the most vulnerable often are the ones where you have to be most proactive in providing vaccine to them. That is not the issue at all. But we have seen, unfortunately, certain sections of the community in the Illawarra and Shell Harbour regions susceptible to the virus more than others. I will ask Dr. Chant to provide some further comment on that.
I think I've spoken about the need to leave no one behind as we take these next steps of opening up, and clearly people that have particular needs like social housing, homeless people, people that are experiencing mental health or drug and alcohol issues, people in our correctional centres and prison systems. I just want to let the community know how hard our local health districts, in partnership with primary health networks and NGOs and Aboriginal community controlled services, are doing to reach out to all of those vulnerable groups. There's some great examples, and I know that the CE in the local health district in Illawarra Shoalhaven is particularly developing targeted strategies to address vaccine access in those vulnerable groups in Illawarra and Shoalhaven. So please just be reassured that our districts are doing some wonderful work. I think you've seen previously the work that Sydney Local Health District in basically outside social housing, providing pop-ups, directly engaging with the community members. That's also happening in South Eastern and all in our other districts as an example. So we are very committed and also appreciate any advice or any ways we can better target those initiatives.
Dr. Chant, the decision to extend Pfizer and Moderna to the over 60s in New South Wales, obviously there's hope that the people who are holding out will come on. You mentioned yesterday you were hoping for a 93%. Do you think you can get higher? Is that it?
Look, as I think I've said before, I'm very greedy for the highest vaccination coverage in the world. Let's do it. I would love to get, we get 95% vaccine coverage for our children. So maybe we could do it. We haven't always historically, we haven't done as well for adult vaccinations. So I'm just so incredibly grateful to the community response to vaccination, and I just want to see it as high as possible. What concerns me is that there is still some misinformation around vaccines, and it breaks my heart when someone who potentially has received that misinformation then goes on to get COVID.
There has been resistance. Do you think this will really help get people over the line, knowing that it's available for people over 60?
I think we're making a pragmatic decision so that there is no barrier for people to take any vaccine. If people have had various views about the vaccines and preferences, this removes the last barrier, and I would just encourage people to take the opportunity to get vaccinated. General practice has vaccine, pharmacies have Moderna, obviously AstraZeneca is also available through pharmacies and general practice. Please get vaccinated now. Pleasingly, we know the vaccines work, but the higher the coverage, the safer we'll all be. But can I just say, please, it sends a shiver down my spine when we say Freedom Day 70%. What I want people to do is take the opportunities afforded to them, but do that cautiously. Still limit your social networks, limit your contact. Just take it easy as we get the vaccine effect flowing through. You're correct, it takes about 2 to 3 weeks for the vaccine effect to come on board. So even think about your actions. If you're not fully vaccinated on the 11th, just consider whether you defer it for a couple of weeks. We do want to take it very easily and cautiously, and it does rely on people complying. I think we have to be very honest with the community. This is a genuine partnership about what the community chooses to do and what business and what the framework that government sets.
Dr. Chant, if I can ask about the Northern Rivers. There's fresh cases in Kyogle and a long list of exposure sites in Lismore, Casino, Byron Bay, Tweed. I know we're not far off lifting all of our lockdowns, but are you considering putting any of these towns back into lockdown?
We've got a process where we go through all of the cases overnight and recommend a range of lockdowns procedures. I would want to just highlight that things will change slightly on the 11th of October. Because remember, at that time, the only people permitted to go to some of the premises, such as hospitality, will be fully vaccinated. And in indoor settings, it will only be children under 12 if you're accompanied by an adult. So there'll be additional controls in place on the 11th, and that will be across regions. And the only people employed in those areas will have to be fully vaccinated. So again, that provides a level of protection on the 11th that we'll have to take into account in our settings of our recommendations to government around lockdown.
2 quick ones to the Treasurer, if I could.
I'm sorry. I know you're still working through those, but is the general view going to try and allow businesses to stay open where possible and not shut them down for big cleaning? You're crying out just for a bit of guidance around this.
Yeah, so we have progressively updated our advice around what we do in businesses, and the key message is we know that businesses need to have their own health and safety responsibilities to prevent workplace transmission of COVID. So it is important that businesses strictly adhere to their COVID safety plans. But what we are factoring in is that if you are vaccinated and you have a highly vaccinated workforce, that reasonably employers can take that into account in whether someone actually meets the definition of a close contact. And so there will be less impact on businesses that where the individual is vaccinated, and overall in the business they have a high rate of vaccination.
And can the fully vaccinated expect that once we do open up and they are in that workplace setting, at the very least, without going into too much detail, they won't have to spend a period of time in isolation?
We're not going to comment on that because that's being formulated, our advice, but clearly, and that will be clearly communicated. But I think the principle I'm trying to articulate is that vaccination status will be a key factor in either whether you meet the definition of a close contact or whether you, and what your recommended actions after that. But as I said, we are formulating that and will be communicating in due course.
Treasurer, I think I've got to get this right. I think I know the answer. Can you objectively say Service in New South Wales delivered JobSaver in a timely and efficient way that didn't cause immense stress for businesses?
Well, there's no doubt that this program took a while to get up and running, and we've apologised to businesses from the outset. What's most important is we got that money out the door, and if you look at the amount of investment that the New South Wales government has put in compared to any other state, we are streets ahead. I mean, if you look at the combined Commonwealth Victorian contribution, it's around $4 billion, whereas in New South Wales it's 12, with New South Wales putting in 8. We're the only state that's provided a platform for businesses with a turnover of less than $75,000. Now, one of the reasons we argued the case for JobKeeper was that platform was already set up. Service New South Wales had to build that platform. That took some time, but the money is flowing, and that's incredibly positive. And now we're in a situation where $8 billion here from New South Wales will get out to every single business who needs it right across the state.
Now, Queensland's edging closer to lockdown. Is it too late? It was only 3 days or 4 days before the NRL Grand Final.
Right.
Is it Bank West, ANZ? Is it possible?
Look, I mean, we'll always pick up the phone if someone rings, but we have a roadmap, and I've said from the outset that we aren't going to hold major events in New South Wales until every small business is open and every worker is back in the job. That is our priority. What's most important for the people of our state is to get back in work and have small businesses flourishing again. And that's certainly my focus, the Premier's focus, our entire cabinet. Yes, we want major events to return back to New South Wales, but there's
might be too early.
Well, the game's on Sunday, and we're based on our roadmap. We'll open up in the first tranche at 70%. But my focus as the Treasurer is to get small businesses open as safely as possible and get people back into work.
Treasurer, can I just ask on the back to school issue? How do you feel as a father yourself, kids going back to school?
It's not just great for kids; it's great for parents, and it's a lot of it's going to be great respite. And I think I want to thank parents right across our state because they've made enormous sacrifices. Balancing work and family life is tough at the best of times, but to have kids running up the walls makes it that little bit more challenging. So I think this is a great announcement, and being part of the crisis cabinet yesterday when this recommendation came forward, I was one of the first to support it.
Thanks everybody.